Question 1. Which organ is primarily responsible for drug metabolism? A. Heart. B. Liver. C. Kidney. D. Lung. Correct answer, B. Liver. Question 2. What is the route of administration that gives the fastest drug effect? A. Oral. B. Intramuscular. C. Intravenous. D. Subcutaneous. Correct answer, C. Intravenous. Question 3. Which term describes the maximum effect a drug can produce? A. Potency. B. Efficacy. C. Half-life. D. Absorption. Correct answer, B. Efficacy. Question 4. What is drug toxicity? A. Desired drug effect. B. Harmful effect of drug at high dose. C. Drug absorption rate. D. Drug distribution. Correct answer, B. Harmful effect of drug at high dose. Question 5. Which organ excretes most drugs from the body? A. Liver. B. Kidney. C. Skin. D. Stomach. Correct answer, B. Kidney. Question 6. What is a drug side effect? A. Intended effect. B. Unintended but predictable effect. C. No effect. D. Allergic reaction only. Correct answer, B. Unintended but predictable effect. Question 7. What is pharmacokinetics? A. What drug does to body? B. What body does to drug? C. Drug manufacturing. D. Drug storage. Correct answer, B. What body does to drug. Question 8. What is pharmacodynamics? A. Drug absorption. B. What drug does to the body? C. Drug excretion. D. Drug distribution. Correct answer, B. What drug does to the body. Question 9. Which route bypasses first-pass metabolism? A. Oral. B. Rectal. C. Intravenous. D. Sublingual. Correct answer, C. Intravenous. Question 10. What is drug half-life? A. Time for drug to double. B. Time for drug concentration to reduce by half. C. Time for drug absorption. D. Time for drug elimination. Correct answer, B. Time for drug concentration to reduce by half. Question 11. Which is an antibiotic? A. Paracetamol. B. Amoxicillin. C. Insulin. D. Morphine. Correct answer, B. Amoxicillin. Question 12. What is analgesic used for? A. Fever. B. Pain relief. C. Infection. D. Sleep. Correct answer, B. Pain relief. Question 13. Which drug is used to reduce fever? A. Antipyretic. B. Antibiotic. C. Antiviral. D. Antifungal. Correct answer, A. Antipyretic. Question 14. What is insulin used for? A. Hypertension. B. Diabetes. C. Infection. D. Asthma. Correct answer, B. Diabetes. Question 15. Which drug group reduces inflammation? A. Antibiotics. B. NSAIDs. C. Antacids. D. Antihistamines. Correct answer, B. NSAIDs. Question 16. What is the antidote for morphine overdose? A. Atropine. B. Naloxone. C. Adrenaline. D. Diazepam. Correct answer, B. Naloxone. Question 17. Which drug is used for malaria treatment? A. Paracetamol. B. Chloroquine. C. Insulin. D. Heparin. Correct answer, B. Chloroquine. Question 18. What is antibiotic resistance? A. Drug works faster. B. Bacteria no longer respond to antibiotics. C. Drug becomes stronger. D. Body becomes immune. Correct answer, B. Bacteria no longer respond to antibiotics. Question 19. What is an allergic drug reaction? A. Expected response. B. Immune response to drug. C. Drug overdose. D. Drug absorption. Correct answer, B. Immune response to drug. Question 20. Which organ is most affected by drug overdose toxicity? A. Brain. B. Liver. C. Heart. D. Skin. Correct answer, B. Liver. Question 21. What is a diuretic used for? A. Pain relief. B. Increase urine output. C. Infection. D. Fever. Correct answer, B. Increase urine output. Question 22. Which drug is used to treat hypertension? A. Antihypertensive. B. Antibiotic. C. Analgesic. D. Antacid. Correct answer, A. Antihypertensive. Question 23. What is drug interaction? A. Drug storage. B. Effect of one drug on another. C. Drug absorption. D. Drug elimination. Correct answer, B. Effect of one drug on another. Question 24. What is bioavailability? A. Drug cost. B. Amount of drug reaching circulation. C. Drug shelf life. D. Drug color. Correct answer, B. Amount of drug reaching circulation. Question 25. Which route is used in emergency situations? A. Oral. B. Intravenous. C. Topical. D. Rectal. Correct answer, B. Intravenous. Question 26. What is the function of antihistamines? A. Reduce infection. B. Treat allergy. C. Reduce pain. D. Lower blood pressure. Correct answer, B. Treat allergy. Question 27. Which drug is used in asthma? A. Bronchodilator. B. Antibiotic. C. Diuretic. D. Antipyretic. Correct answer, A. Bronchodilator. Question 28. What is drug tolerance? A. Allergy to drug. B. Reduced response after repeated use. C. Drug overdose. D. Drug elimination. Correct answer, B. Reduced response after repeated use. Question 29. Which drug is used to treat infection caused by bacteria? A. Antiviral. B. Antibiotic. C. Antifungal. D. Antimalarial. Correct answer, B. Antibiotic. Question 30. What is a placebo? A. Active drug. B. Inactive substance given as treatment. C. Antibiotic. D. Painkiller. Correct answer, B. Inactive substance given as treatment. Question 31. Which drug is commonly used to treat tuberculosis? A. Insulin. B. Rifampicin. C. Paracetamol. D. Heparin. Correct answer, B. Rifampicin. Question 32. What is the main action of anticoagulants? A. Increase blood pressure. B. Prevent blood clot formation. C. Treat infection. D. Reduce fever. Correct answer, B. Prevent blood clot formation. Question 33. Which drug is used to treat peptic ulcer? A. Antacid. B. Antibiotic only. C. Diuretic. D. Analgesic. Correct answer, A. Antacid. Question 34. What is the purpose of vasodilators? A. Narrow blood vessels. B. Widen blood vessels. C. Kill bacteria. D. Reduce fever. Correct answer, B. Widen blood vessels. Question 35. Which drug is used in anaphylactic shock? A. Insulin. B. Adrenaline. C. Paracetamol. D. Aspirin. Correct answer, B. Adrenaline. Question 36. What is the effect of beta blockers? A. Increase heart rate. B. Reduce heart rate and blood pressure. C. Cause infection. D. Increase blood sugar. Correct answer, B. Reduce heart rate and blood pressure. Question 37. Which drug is used to treat epilepsy? A. Anticonvulsant. B. Antibiotic. C. Antipyretic. D. Diuretic. Correct answer, A. Anticonvulsant. Question 38. What is drug absorption? A. Movement of drug into bloodstream. B. Drug elimination. C. Drug storage. D. Drug interaction. Correct answer, A. Movement of drug into bloodstream. Question 39. Which route is best for unconscious patients? A. Oral. B. Intravenous. C. Sublingual. D. Topical. Correct answer, B. Intravenous. Question 40. What is drug excretion? A. Drug breakdown in liver. B. Removal of drug from body. C. Drug absorption. D. Drug distribution. Correct answer, B. Removal of drug from body. Question 41. Which organ is responsible for drug excretion? A. Liver. B. Kidney. C. Heart. D. Brain. Correct answer, B. Kidney. Question 42. What is a loading dose? A. Small maintenance dose. B. Large initial dose to reach therapeutic level. C. Toxic dose. D. Placebo dose. Correct answer, B. Large initial dose to reach therapeutic level. Question 43. Which drug is used for hypertension emergency? A. Antihypertensive. B. Antibiotic. C. Antifungal. D. Antacid. Correct answer, A. Antihypertensive. Question 44. What is drug metabolism? A. Drug storage. B. Chemical breakdown of drug in body. C. Drug injection. D. Drug packaging. Correct answer, B. Chemical breakdown of drug in body. Question 45. Which drug is used to treat fungal infections? A. Antifungal. B. Antibiotic. C. Antiviral. D. Antimalarial. Correct answer, A. Antifungal. Question 46. What is synergism? A. Drugs cancel each other. B. Combined effect is greater than individual effect. C. No drug effect. D. Drug resistance. Correct answer, B. Combined effect is greater than individual effect. Question 47. What is antagonism? A. Drugs enhance each other. B. One drug blocks effect of another. C. Drug absorption. D. Drug metabolism. Correct answer, B. One drug blocks effect of another. Question 48. Which drug is used for nausea and vomiting? A. Antiemetic. B. Antibiotic. C. Antipyretic. D. Analgesic. Correct answer, A. Antiemetic. Question 49. What is therapeutic dose? A. Toxic dose. B. Safe and effective dose. C. Placebo dose. D. Overdose. Correct answer, B. Safe and effective dose. Question 50. Which drug is used for constipation? A. Laxative. B. Antidiarrheal. C. Antibiotic. D. Antipyretic. Correct answer, A. Laxative. Question 51. What is the function of antidiarrheal drugs? A. Cause diarrhea. B. Stop diarrhea. C. Treat infection only. D. Reduce fever. Correct answer, B. Stop diarrhea. Question 52. Which drug is used for asthma emergencies? A. Bronchodilator. B. Antibiotic. C. Antifungal. D. Antihypertensive. Correct answer, A. Bronchodilator. Question 53. What is drug compliance? A. Ignoring medication. B. Taking drugs as prescribed. C. Drug overdose. D. Drug resistance. Correct answer, B. Taking drugs as prescribed. Question 54. What is a contraindication? A. Drug benefit. B. Situation where drug should not be used. C. Drug dose. D. Drug storage. Correct answer, B. Situation where drug should not be used. Question 55. Which drug is used in cardiac arrest? A. Adrenaline. B. Antibiotic. C. Antifungal. D. Antipyretic. Correct answer, A. Adrenaline. Question 56. What is plasma half-life used to determine? A. Drug cost. B. Frequency of drug dosing. C. Drug color. D. Drug packaging. Correct answer, B. Frequency of drug dosing. Question 57. What is a toxic dose? A. Safe dose. B. Harmful dose. C. Maintenance dose. D. Placebo dose. Correct answer, B. Harmful dose. Question 58. Which drug is used for malaria prevention? A. Antibiotic. B. Antimalarial. C. Antifungal. D. Analgesic. Correct answer, B. Antimalarial. Question 59. What is drug accumulation? A. Drug excretion. B. Buildup of drug in body. C. Drug metabolism. D. Drug absorption. Correct answer, B. Buildup of drug in body. Question 60. Which drug is used to reduce stomach acid? A. Antacid. B. Antibiotic. C. Antifungal. D. Antiviral. Correct answer, A. Antacid. Question 61. What is pharmacovigilance? A. Drug manufacturing. B. Monitoring drug safety. C. Drug packaging. D. Drug storage. Correct answer, B. Monitoring drug safety. Question 62. What is drug overdose? A. Low dose. B. Excessive dose above safe limit. C. Normal dose. D. Placebo use. Correct answer, B. Excessive dose above safe limit. Question 63. Which drug is used in diabetes emergency hypoglycemia treatment? A. Insulin. B. Glucose. C. Antibiotic. D. Antipyretic. Correct answer, B. Glucose. Question 64. What is drug dependence? A. Drug cure. B. Need for continuous drug use. C. Drug elimination. D. Drug interaction. Correct answer, B. Need for continuous drug use. Question 65. Which drug is used for sedation? A. Sedative. B. Antibiotic. C. Antifungal. D. Antipyretic. Correct answer, A. Sedative. Question 66. What is tolerance development in drugs? A. Increased sensitivity. B. Reduced response over time. C. Allergy reaction. D. Immediate cure. Correct answer, B. Reduced response over time. Question 67. Which drug is used for shock management? A. Adrenaline. B. Antibiotic. C. Antacid. D. Antifungal. Correct answer, A. Adrenaline. Question 68. What is drug formulation? A. Drug effect. B. Preparation of drug into usable form. C. Drug elimination. D. Drug overdose. Correct answer, B. Preparation of drug into usable form. Question 69. What is a generic drug? A. Expensive branded drug. B. Drug without brand name. C. Herbal drug. D. Toxic drug. Correct answer, B. Drug without brand name. Question 70. What is the main goal of pharmacology? A. Drug production. B. Study of drugs and their effects. C. Surgery practice. D. Disease diagnosis. Correct answer, B. Study of drugs and their effects.